Hi, I'm Dr. Eric Westman, and this is the Keto Made Simple podcast.
Dr. Westman here. Well, I thought I'd start out with a story and a metaphor, and I'd like you to help me with this metaphor. Let's imagine we're explorers. Let's imagine, and my apologies to the non-Americans on the Zoom. I'm going to give the story based on the American or North American centric view of exploration, what we were all taught with as children in the U.S. And that is, so 25 years ago now, you and I decided to leave Spain. Okay, so the metaphor is we're going to go from Spain to the New World, the Old World to the New World, and the metaphor is low-carb diets. You'll get the mixture in just a minute. So 25 years ago, I had a slide at a meeting that basically said, we're exploring here. We're leaving the old world, going to the new world, and I'm not quite sure where we're going. And I had a little cartoon that had the USS low-carb for the maiden voyage of leaving Europe, exploring the new world. You could use it for any other country where the first people visiting. So you have to remember that the reason we left. Okay, so this 25 years ago we left Spain, or we started the low-carb diet myself 25 years ago. We didn't know where we were going. In fact, people said we would fall off the end of the earth. It didn't happen, remember? I mean, we found land. Well, we had to go through some stormy seas, perhaps, along the way. But, and people might not have thought it was a great idea, but we did it because we were leaving a certain situation that we couldn't stay in, right? So whether it be the lack of religious freedoms, or you would be put in jail for something minor, or anyway. So we all embarked on this. But remember, this was 25 years ago in terms of the diet. We made land. We learned how to use the new world. We were taught by people who already lived here. We found out the hard way that things that looked edible in the old world were not, and they were poison. And so we didn't listen. We ate those things. Some of us died along the way, but we feel happy and healthy and well. We might miss the old world, the old paradigm, the old medical view of things, taking medicines. The doctors make you feel comfortable taking medicines. Don't worry, we'll manage you. It'll all be fine. But it wasn't fine. We left that in. And I just have to remark that we've been here 25 years and nothing bad has happened. In fact, we've thrived. We've built our communities. We've had children and grandchildren, and we have a new world. Sure, we might miss the old way from time to time, but we had to leave. We found, against everyone's expectations, a new place to live. And we're actually thriving. But the rules have been different. In fact, the old kind of laws and guidelines in Europe, we didn't like. We wanted to leave there. And now I'm going to say the current medical guidelines, they're not right for us. We left that. We're in a new place, and we're actually in a new metabolism. And that's kind of the twist here. So that's not the new world geographically. It's exploring a new metabolism. And there are going to be some things we honestly don't know. But, after 25 years of my life doing this, and then you remember, it wasn't me that made this up. If you don't know my story, 2 of my patients did a low-carb diet, and they taught me, without me, that they could do it by reading a book. So the real pioneers were Dr. Atkins, Dr. Eads, Dr. Rosedale, Dr. Bernstein. So let's go back to the Spain or leaving Europe. We actually heard that people visited the New World and they said it was actually great, but most people didn't know about it. In fact, most people were against it, and it threatened the ideology that the earth was flat and the earth was the center of the universe. So all of these different paradigms kind of clash in. And a low-carb diet, sometimes your cholesterol level will go up compared to people who eat carbs, the older paradigm view. Sometimes I just honestly say, I don't know if it's harmful. And yet you'll meet other people who say they know it's harmful when they really don't. And so remember, we left that world of here's the way to do it. There's only one way to do it. And now we're exploring a new area. Now getting to diabetes, we don't know the proper level of blood glucose when you're on a low-carb diet, or the optimal level. We don't know. And so if you're just starting out and you're trying to fix diabetes and you cut the carbs out of the diet, the blood sugar will come down 50 to 100 points on the first day compared to what you were eating. That means that we have to cut back on the medication on the first day. So remember, the old way was to let you eat anything you want. And it just defies explanation why people with type 2 diabetes come into me drinking sugar. This should be the first thing any doctor asks their patient with type 2 diabetes. Are you drinking sugar? Because that will just directly be absorbed and raise the sugar, but it happens all the time. So the diabetes medicine have to be reduced. And the idea that, okay, we're in the new world, we're learning, and it might be hard work to transition people here, to get people off the old way of thinking. And the other main thing with diabetes is if you cut out the carbs, your blood glucose might not normalize on the first day. So it's not just the blood glucose a response to the diet and the drinks, but there's also the weight loss. So you have to have a resolution of the underlying insulin resistance, which is from the extra weight. So in this class where we have now hundreds of people, and they may be joining the membership, they'll have an option to join the ALA membership. The expectation of a lot of people is, well, I cut my carbs, why isn't my blood sugar normal? Well, if you have a journey of weight loss to go down 50, 100 pounds, then your blood sugars aren't going to be normal until you're down that weight. And so it might take a year to get normal blood glucoses if you have insulin resistance from that extra weight. So everyone wants things to, immediate gratification isn't fast enough. You want it yesterday, right? And everyone said keto and carnivore would fix the blood sugars, right? You get a dramatic reduction by cutting the food carbs, but you might not get normalization if you have a journey of weight loss. Now, let's say you're at your goal weight and you have a blood glucose that is 110. And there's this advent of people now. Recently I said, you're a biohacker, when someone who didn't have type 2 diabetes was wearing a continuous glucose monitor. And we chatted about it. And it's very common for people to be concerned about a blood glucose under 120 kind of randomly throughout the day or first thing in the morning, even though the 3-month average is normal, or even, below normal, or maybe even a little high. So we don't know, honestly, about a blood sugar that's just a little bit higher than the diagnoses of diabetes. We don't know if the categorization that was used in the old paradigm of people eating carbs, people being treated with medicines, there may be other factors, including the carbohydrate oxidation of the food that you're eating. So the food that you eat becomes the food that you burn for fuel. And if you cut the carbs way down, you'll have an improvement in that oxidative stress, even though you're still not having a totally normal blood glucose. I'm trying to just reassure you that if your blood glucose is not, between 80 and 100 all day long, it's okay. And I would even, if you're at an optimal weight, you feel great, you're eating foods you love, I would discourage the use of obsessive monitoring of the blood glucose. It's just going to cause anxiety. It would be like, back in the old world, we cooked things a certain way and we had certain foods, but now we don't have them here in the new world. Well, we'll make do. We'll find a new way to cook. We'll find other foods to have. So the old paradigm and the new paradigm is a metaphor for also fear. People are afraid that, I have a little bit of blood sugar elevation. I have type 2 diabetes or pre-diabetes. And I'm trying to just say, wait a sec. That categorization was based on studies where people were eating carbohydrates. And so the rules, I think, are different. And what's the data I have? It's the fact that people are following a healthy diet and everything else is optimized. This is kind of the same kind of face validity or common sense rationale that an elevated blood glucose or blood cholesterol in the context of a low-carb diet isn't going to have the same connotation, or you shouldn't have the same worry as if you were a carb eater with the same level of cholesterol. Now that's our perspective from being in the clinic. And, do we have randomized controlled trials about that yet? No. There are observational studies that are being started. But remember, we left the old paradigm of medical care, of the old world, because we weren't satisfied with a medical system that didn't ask you what you ate. When was the last time a doctor asked you, really, what do you eat for breakfast, lunch, and dinner? We weren't satisfied with a medical system that didn't really consider diet as a major factor for health. And that, you go to a veterinarian, the first thing they say is, what are you feeding them? What are you feeding her? So the medical system has gotten off track, and they will diagnose you, they will put you on medications, and yet there's no consideration of lifestyle, the importance of lifestyle. I coach people to say to their doctor, yes, I know my cholesterol is elevated, but I'm using lifestyle to treat it. That will get you a certain way. And then if the advanced course really is that we focus on the metabolic syndrome, which is the triglyceride and HDL in the blood, and we don't focus on the total cholesterol and LDL. If you want to do the LDL story, you can check for small and large LDLs. You can look at the LDL insulin resistance score or LPIR score. There'll be insulin resistance score on the NMR lipo profile. But this is one reason why I don't think we should focus on the blood so much, and we should focus on the arteries themselves. The cholesterol is not a disease. The reason we focus on it is to prevent atherosclerosis, to prevent the hardening of the arteries, the narrowing of the arteries. So what you want to do, if you can, is to measure whether you have the arterial disease already, and you can do that with various measurement tools. So, I understand some people are not satisfied when I say we don't know, and we're exploring a new world. Should we start going west from where we are, where we don't know in the exploration there? This is the North American explorer metaphor. Or do we just stay here, except a lot of people are here, so some of you will want to go push west and learn. The idea, though, that everything from the old world paradigm would apply here in the new world, it's just pretty obvious it can't. In fact, if we look at the stars are different than where we were before. And so I'm just trying to get you into the mindset that there may be differences in comparing your lab tests, the food you eat and what other people say about the food you eat. There may be differences in the health consequences. Remember, we've been here 25 years with the science. And as I reflect on it, other people were doing studies to prove that this was bad. And now that I kind of have reflected on this over the last few years, Gary Foster did one of the first studies in the New England Journal of Medicine, and he was kind of disappointed that he didn't find that the low-carb diet was bad. He has gone on to be director, Weight Watchers, and other sorts of places. He's a PhD. Bonnie Bream in Cincinnati, I remember that study, and the purpose of the study was to show that the low-carb diet, the Atkins diet, was bad, and it wasn't. And so there have been now meta-analyses of studies of low-carb and low-fat, and the low-carb diet wasn't bad. In fact, it was better than the low-fat diet, pretty much in every instance. And they're in studies of studies now. And so when people say that leaving the old world and finding the new world is going to be dangerous and terrible, well, we've proven that it's not true. We made it. And you might be new to this way of eating and way of thinking, but it's not new in terms of the science and the credible evidence of its safe use. That's unlike any other diet that we know about. The low-carb diet has been studied over and over and over. And the sad reality is it was studied to people with the intention of the people to show it was bad, and it wasn't. So they never did the second study. Fortunately, now 20 years since our first study, the NIH, National Institute of Health in the U.S., is finally funding some research, but it had to be done by trainees, what's called K awards, meaning they're very low in amounts. And the reason is our system is set up to find out the mechanism of how things work rather than fixing human disease. That's just the reality of the mission of the National Institutes of Health. It kind of was surprising to me and disappointing when I went to our Duke funded researchers on fatty liver and on McArdle disease, where I had evidence that you could reverse these conditions, and they didn't pick it up. Well, they were funded by the companies trying to find the mechanism of fatty liver and the companies trying to put genetic changes into the cell so that it didn't matter what people ate, they could fix the problem independent of the food intake. So in fact, if I put everyone in the fatty liver clinic on the low-carb diet, they wouldn't have anyone for their studies. So one might argue that that's not ethical, and I sure hope they put in the consent forms that there are other effective ways to fix fatty liver, weight loss of any method really. But I haven't, gotten to that level of being a pest or a thorn in someone's side. So with diabetes, what I'm seeing is that medications are being used over and over, and yet the medications have terrible side effects. So you can go down that path of eating whatever you want. The doctors don't give you grief, but you put on medicines that have pretty bad side effects. And probably the one that just kind of grates against my sensibility is the medicine that allows the urine to leak glucose. So you're not supposed to have glucose, sugar in the urine. All sorts of bad things can happen with infection and loss of energy. And so the medicines called Jardiance or Invokana, the ones with the fun jingles and fun people on TV. No, in the fine print, and even they're forced to say it now, that ketoacidosis can be life-threatening and a genital infection can be life-threatening. I've seen now over and over people who've been on these medicines having infections of the urine, and the doctors just treat it as if it was just a common side effect. And then, the terrible reality is they don't focus on the food carbs. They'll say, well, just continue what you're eating. We'll just have your kidneys leak out the carbs, which, it's just kind of crazy. So please, if you're on a medicine, they're called SGLT2 inhibitors that allow the glucose to get into the urine, please reconsider, talk to your doctor about that. I had never seen ketoacidosis in my clinic, my keto diet clinic, until these medicines came out. So you're at a higher risk of ketoacidosis if you do a keto diet, but you're at risk of ketoacidosis even if you're eating carbohydrates, which is pretty scary. As a side effect, it can be life-threatening and it can happen really fast. So medication care is not the only way to go about things. Remember, the reason we left that old world, the old paradigm, is we didn't think that was really the answer for us or for a lot of different people. And we just found a different way to go about it. So recently I was asked to become a part of a new organization called the American Diabetes Society. It's so fledgling. It's working its way through being formalized. And the idea is to have a society that actually promotes diet and lifestyle as an alternative to medication, and then promoting the idea that you can reverse type 2 diabetes. You don't just have to manage it with medications. The other aspect of this organization is all funding will be transparent. So you can see who is funding the organization and where the money goes. Been a lot of criticism about the other alternative diabetes organizations where they're getting lots of money from certain entities, so they just kind of spout out the information of the funders that give them money, and they really don't talk about lifestyle much at all. They don't really talk about reversal of type 2 diabetes. So the American Diabetes Society will be focused on that. There is a small group of people. We're still looking for board members, and there was a GoFundMe to start a website. And in 3 days, we raised $50,000, and we'll be raising more money over time. But the plan is to become a teaching and entity and a resource to push information about diabetes reversal using lifestyle. Certainly, low-carb diets are one of them. One of the lifestyles that work, not the only one, of course, but there will be little, if any, emphasis on the use of medications. Although if you're on a medicine that leads to weight loss, if you have diabetes and you're on a medicine that leads to weight loss, you might actually reverse the type 2 diabetes. And that's because the weight is typically the underlying factor that caused the diabetes in the first place. So, in the U.S. metaphor of exploration, time happened, the towns were built, and finally there was a revolution to leave the oppressive kingdom from before. So this is kind of like making a new organization. I know that's a stretch. But it's okay to make a new organization based on new principles, and then there might be some tension or backlash from other organizations, but I doubt it. I think you start a new group, you don't create a whole lot of friction with the older group. It's really not a Britain American Revolution sort of thing, although that drama would be okay, I guess. So stay tuned for the American Diabetes Society. There's a GoFundMe up now. The few people on it at the moment are all very passionate, and we want a group of lay people and dietitians and doctors, all of the all of the above. And the idea is to create a new group that isn't just focused on drug treatment, drug management of the type 2 diabetes. Again, the course we have going on, I'm learning a lot of questions, a lot of people actually reversing their type 2 diabetes already, who just want to make sure they're doing low carb correctly. The use, I'm constantly reminded that, my introduction to this diet was from 2 of my patients who did it on their own by reading books. So you don't really need me personally or someone other than to teach you how to do it. But if you're on medicines that might become too strong, you have to be careful because the medicines may cause problems, not the diet itself. So please do this with someone who understands the deprescribing of the medication safely. Going back to that new and old paradigm, there was also a book called Scientific Revolutions. It basically said what's necessary for a paradigm shift. And of course, if you were put into a new world, you have to learn very quickly. But even the establishment, eventually, if you can fix something that someone else can't fix, that's kind of one of the most important things for a paradigm shift. So I think the more we demonstrate that type 2 diabetes can be reversed, and people can do that on their own by changing the food independently or even, against the doctor's advice, people are taught how to do that, then people will gravitate toward the new paradigm that lifestyle is really more powerful than medications. The other thing is with paradigm changes is that you have to give people, the doctors, the tools to fix things. So rather than me tell everyone that the low-carb diet fixes brain health, the low-carb diet fixes heartburn, the low-carb diet fixes fatty liver, the low-carb diet fixes the cardiovascular disease. Well, you see, that's really what Dr. Atkins knew and what he tried to tell people, but that doesn't change the paradigm. So what you need to do is allow other doctors to use that information, and actually what happens is they think they came up with it first, which is just fine. So what we saw in the last 20 years is that a cardiologist wrote a book called Wheat Belly. Remember Bill Davis in that book? So he carved out the cardiology part of it and focusing on wheat. We had another neurologist write Grain Brain, which is David Perlmutter writing a book about the brain. And now they have independent groups that they've continued to follow on their own. But what's really needed is that this information be gravitated now toward gastroenterologists about the fatty liver and the heartburn and irritable bowel syndrome. And interestingly, last month, a randomized controlled trial for irritable bowel syndrome, diarrhea predominant, was published with large study with 3 arms. It was the drug treatment, the FODMAP treatment, where you don't have simple sugars, and the low-carb diet, which ranged from 50 to 100 grams of carbs a day. So it really wasn't keto. But the low-carb diet won in terms of IBS-D, irritable bowel syndrome, diarrhea predominant symptoms and reversals. So the drugs were really not very helpful. The FODMAP diet helped a little bit, but the low-carb diet was best. That's published in 2024. I looked back, and one of the references is Greg Austin's paper that we helped him do back in 2009. So 15 years passed between our first paper that was published. You could say it's a proof of concept paper, but now a randomized trial was done that pretty much nailed that the low-carb diet was superior to the drugs and to the FODMAP, the low-sugar diet. Just showing, remember, we've been here a long time. But just because the people in Spain don't know that we're here, it doesn't matter. I mean, they're living their lives, being happy, And we created a new world within this metabolic space, not geographic, but metabolic space. And it's grown. And, I'm very proud of that textbook that Tim Noakes, Professor Noakes, was the major editor on, called Ketogenic, the scientific basis of the low carb or therapeutic carbohydrate restriction is the term we use for this kind of approach, low carb diets. So I guess what I'm trying to say is this has always been a grassroots kind of change. We've learned a tremendous amount, and we're still learning. And if you just compare the blood levels and to the old way of looking at things, it may not make sense. That's why I'm focusing on measuring the arteries rather than just the blood, because there's a lot of inappropriate focus and fear-mongering about following a diet that raises a blood LDL a little bit, even though the HDL is 80 or 100. And then the idea that a blood glucose isn't between 80 and 100 all day long, that's not the expectation. And so please don't worry if you're in that situation without, complete, labs that look like carb eater. That I think we're going to find a difference. A new normal range is probably going to be developed by this company, ownyourlabs.com. David Feldman, who has put together the website, The Cholesterol Code, and the study of lean mass hyper responders, also created a company where you can get your blood drawn at any LabCorp facility in the U.S., and you can measure pretty much any lab, and you have to pay for it on your own, though. That's the catch. But they keep it in their own private, secure database, so no other entities can get to it. And I'm afraid that most blood work that's in the insurance pay system, medical care, can be looked at by insurance companies, whether you want it or not. So ownyourlabs.com, if you want to contribute, they ask, what kind of diet are you following? And then hopefully they'll be able to survey or publish their information about, we had, 1,000 people who say they're doing a carnivore diet, and here are their A1Cs. And we might even find that they might have a broader range of hemoglobin A1Cs and not be in the same range as people who eat carbohydrates. Same with the cholesterol levels. We'll probably see that the normal range of triglyceride is going to be much lower than those who are eating carbs, but that range of LDL might have a wider range. The cholesterol as well, wider. And then the HDL will probably be higher. Of course, how long you've been on the low-carb diet will affect that HDL. But it may take months to years. I think Lisa reminded me, we've been working 2 years on this diabetes study, and like the Keto Made Simple and other courses at Adapt Your Life Academy, we filmed the lessons, have the transcripts of the lessons, and have people in Zoom calls so they can ask questions in real time as they're taking the course. I think many of you might be in that course as well. I hope you're enjoying it. And the interesting thing is some people are coming already fixing their diabetes, just wanting to make sure they're doing it, correctly. Then some people are brand new and they've never even, tried the diet at all. So it's kind of like teaching a math class where you're teaching basic math and calculus all in the same group. So that's been an interesting sort of thing. The personal questions, we can get into that detail, and then the course will evolve over time based on the feedback, kind of like the Keto Made Simple courses. Each time we received surveys, we changed some of the content and some of the frequently asked questions based on the feedback that we received from you. So I guess that kind of concludes my formal talking. Let me see. The boiling frog story as a metaphor. Okay, yeah. So that's the idea that a frog can be, if you change the temperature gradually, it doesn't feel that difference. So if you have a gradual change in anything, you may not notice it yourself. I mean, that played out recently in someone who didn't know that he had actually lost weight. He couldn't really see it in himself. So the idea that you can actually boil a frog without it knowing it, if you do the temperature really slowly, for the inability or unwillingness of people to react or to be aware of sinister threats that arise gradually rather than suddenly. And that is a good description of the current health debacle. Thanks, John. So if you have any thoughts about the old world, new world, I did create that slide 25 years ago, and I ended the talk with saying that I'm on the boat too. So that I think is important, because if you talk to someone who's not in your same situation, what's it's like the pilot of the plane is on the plane with you. So they're going to do everything they can to keep the plane from crashing, right, and have a safe landing. And that's similarly with the low-carb diet. I got onto it just to learn what it was like to be able to teach people. And I didn't have any tremendous weight loss or metabolic change journey, but I just liked the way it felt, and it was easy to do, hunger going away, a lot of energy. Then, of course, I watched every other lab changing and getting better. Although, going back, I dropped someone out of our second study because the LDL went up. And so 25 years ago, I was worried about the LDL too. Well, I'm not anymore, but I was back then. So just as I've been in the old paradigm, and I really kind of have a foot in the old and a foot in the new. And I think it's important to have that, be able to have discussions that are scientific, and then also to just follow the science. The science has to embrace a new observation that doesn't fit into the old paradigm. Otherwise, it's not science. We're just talking dogma, more religion and belief than science. But the problem with that statement is that science is a self-writing measure. The idea is you will eventually find truth, but that's only if you can get funding to do the studies. I mean, to actually ask the right questions. And sometimes the studies that are needed are very expensive. And so you can constrain the research in a certain area by not allowing funding there. We saw that recently, relatively recently, a colleague of mine in the obesity world kind of got called out because Coca-Cola was funding his lab to study exercise. And, it never occurred to Jim that he was kind of haplessly being directed away from studying sugar and diet because he wanted to study exercise. So why not take money from an entity that, doesn't want you to study their diet or their food as a health issue? When that got publicly aware or publicly outed, it didn't go well. And so he actually had to move from Denver and didn't sustain that funding. But, we saw that with the tobacco industry and now with the food industry, where they're going to be funding people to study anything other than their food as a possible cause for a problem. So don't be surprised. And that just goes back to the American Diabetes Society, not association, ADS, not ADA. The ADS will be totally transparent where the money's coming from, where the money's going. If you have interest in getting involved, let me know. It's just really at the beginning phases, but we'll need a lot of people involved to operationalize the plans to get the information out to people. And that takes a lot of money for sure. Thanks for tuning in, and until the next time, hope you do well. Be well. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.